Hi, I'm Dr. David Minkoff from LifeWorks Wellness Center. I want to talk to you today about cardiovascular disease. Probably all of you who are watching this have been affected by it in some way because it's the thing that kills more people in this country than any other thing. Now, cardiovascular includes things where the heart artery gets blocked and you have a heart attack, or where the heart can't pump because the muscle's too weak, or because someone has high blood pressure, or someone gets a stroke. These are all things that have to do with blood vessels and circulation. And the problem with our modern day living is that we accumulate a lot of things in our body which damage the inside lining of our arteries. That lining is called endothelium. Endo means inside. And that lining gets damaged and it gets inflamed. And things that we call free radicals. Now, free radicals can be heavy metals or friendly metals like iron, or viruses, or bacteria, or things, plaque from the teeth. These organisms can get in the bloodstream and they can go to areas inside blood vessels and they can set up inflammation and infection, and the body's protection against this is to put a Band-Aid on that is made out of a waxy substance called cholesterol. And as that process continues with more inflammation and more cholesterol laydown, that artery, which might only be a little bit bigger than a pencil lead, and has to serve a portion of the brain or a portion of the heart, gets smaller and smaller and smaller, and pretty soon the flow isn't going. And then that tissue that's at the end that's supposed to get that blood so that it can get oxygen and nutrients doesn't get the blood, and it dies. And that's a heart attack, or that's a stroke. So this is, to a large extent, a preventable thing. We know there are risk factors. You know, if you're overweight, or if you have high blood pressure, or if you smoke, or if you don't exercise, or if you eat a diet that's full of fast and processed foods, that you are at risk. But we also know that the risk factors of some other things, there are some chemicals in the blood which can also be irritating, like homocysteine, or if your fibrinogen is too high, it means your blood's clotting, your blood is irritated, or some lipoproteins like lipoprotein small a, that these can be measured and find out if you're at risk, because the family history in these things is very high, but they are preventable, or there are things that we can do with lifestyle and diet and supplementation to help people. Now, one of the big causes of this vessel disease is heavy metals. If there is a lot of lead in your blood, or mercury in your blood, or arsenic in your blood, these cause inflammation, and they can cause this reaction inside your artery, and they can make you more susceptible. So we treat this disease very different than a typical cardiologist would. There are about 1 million people a year in the United States that get stents put in. They get catheterized, they get a stent put in because they got a blocked artery. Sometimes this is a life-saving procedure, and it's quite necessary. Sometimes people are so bad that they need blood vessels that are actually transplanted veins from their legs into their heart because their blood vessels are so blocked. And sometimes that's life-saving. About 500,000 people get that per year. But people can be looked at early before they have that heart attack, before they have that disease, where there are therapies that we can do to improve body oxygenation, to get heavy metals out, to balance the nutrition, to improve the antioxidants, so that person is not going to get cardiovascular disease because we can prevent it and we can cool off the inflammation. And that's the best way to do it. You know, you probably don't know this, but the first sign of heart disease in about 50% of people is that they have sudden death from a heart attack. You know, they went to their doctor, they had a regular exam, and then they had a heart attack. Now, the doctor didn't do a bad job. It's just that the tools that he was looking at that person with weren't good enough to make sure that that person wasn't susceptible. And so we do an in-depth evaluation to find these things that are what are called antecedents. These are the things that will become heart disease or vascular disease, and find out where are yours now, where your hormone levels are, how good is your circulation, do you have these inflammatory things going on in your body. And then we have ways using oral and sometimes IV nutrition to improve them so we get better function. We recently had a patient who was overweight, who was getting chest pain, who went to his cardiologist, and his heart was only beating about 35, the heart, when it pumps blood, is supposed to pump out at least half the blood that's in it each contraction. His heart was only pumping out about 37%, and so he was having trouble and he was having chest pain. And the cardiologist suggested to him that he get a heart catheterization and then he get stents put in, because probably that was what his problem. Well, he was afraid to do that. He came to see us. We put him on a program so that he could lose some weight, because he was overweight, so he lost about 30 pounds. We put him on a program where we did some therapies which improved the oxygen in his body. We did another therapy that we call EECP. It's a way where you put blood pressure cuffs on the legs and the lower abdomen, and it pumps, and it actually gets the body to make more new blood vessels around those that are blocked. It's even an FDA-approved treatment, and it's tons of good data on it that show that it works. So he did that treatment. And then he got some other treatment. He had very high lead levels in his body to get the lead out of his body, because lead causes this reaction. Well, 3 months later, he went back to see his cardiologist. And his heart was now beating in normal rhythm, and his ejection fraction was over 60%. He had no more chest pain. He could walk several miles without any problem. Now, to my mind, that's good medicine. He didn't have an operation. Nothing done was dangerous. There was no risk. And not only did the heart arteries improve, but this process is going on in people, not just in their heart. It's going on in their brain, it's going on in their kidneys, it's going on in their liver. And by doing these systemic treatments, where we're doing things to improve the overall health of the body, you get the whole body better. And so his health is really improved, and he's not the kind of guy that's going to have to walk around worrying, is he going to have a heart attack any minute, because his function's better. And that's what we want. So if you know someone who's got heart problems or symptoms, or you have them, come see us, because we're really good at this, and we can help people. And we have lots of successful cases where people were able to avoid the invasive procedures, you know, the operations and the bypasses and things like that, where their overall health improves. Okay? So come see us. We're LifeWorks Wellness Center. Phone number is 727-466-6789, or you can see us on the web at lifeworkswellnesscenter.com. Thanks for your attention.